Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut. We are back this week to talk about eyelids. But before we get into that, I want to thank our sponsors, Rejuvime Medical, Louisiana's largest age-defying clinic, which means we are in all things hormone optimization therapy, GLP-1s, peptides, everything you need to make you feel 18 again, which is what we all are looking for.
We're all striving.
We're all striving to do. And then, of course, Weiler Plastic Surgery Group, the largest plastic surgery group in Louisiana with 5 board-certified surgeons, a whole group of absolutely amazing expert injectors, estheticians, and now with over 10 locations.
Blanketing the southern part.
Gulf.
Blanketing.
Yeah.
Blanketing
southern Louisiana and probing into southern Mississippi.
Yes. And, Rejuvime is, we've moved out to the West Louisiana now.
Yeah.
So we just opened up a location in Lake Charles.
Lake Charles is open.
Yeah.
Yes.
Lake Chuck.
Lake Chuck.
Amazing.
Lake
It's
Chuck.
kind of a booming place.
It's
Lake
wild
Charles.
over there.
Yeah, it really is.
It's absolutely wild over there. It's a beautiful building.
Yeah, it's a beautiful building.
Yeah.
Lake Charles is if you think Louisiana is beautiful, then Lake Charles is beautiful. Louisiana, it's very
Is it?
it's very Louisiana. It's very marshy. It's very
Okay.
Well, yeah. I mean,
I think there's great look.
some of the great a little south of Lake Chuck in Cameron Parish is like
Hunting.
the best duck hunting.
Yeah.
Oh, I know.
That's what I thought
that's
he
my
was
point.
gonna
I love
say.
obviously Colorado is beautiful, right? The mountains, the snow.
Yeah.
But there's nothing like a swampy marsh.
I think there's great beauty in the marsh. I love part of I'm a big duck hunter, but I love a crisp, cool winter morning, laying out there and sun coming up. It's really pretty, but it ain't everybody's cup of tea.
I do
because it's
enjoy it.
brown, it's muddy.
Yes, but I do.
sulfury.
I like I absolutely enjoy the cypress with and just looking on the water and everything like that. I do. I agree. I think there is beauty too.
I think there's great beauty in it. So I love it. I think Lake Charles is.
I don't think anybody's going to come from California or Colorado that lives in the mountains and come and say the swamp is beautiful. If you want me to be totally honest, it's very murky water.
I agree, but look, I think it's an acquired.
Don't worry about the cottonmouth next to you. Don't worry about that.
The
Don't worry about the
alligator.
alligator. Don't worry about that. That's fine.
Don't worry about
Don't
the
worry
giant
about that.
hive of million bees.
Exactly.
That's gonna
Don't
fall
touch
out
the
or
water.
snake that's
He
gonna fall
sees
out the
beauty
That's
as
it.
he is hunting for ducks. That's
But
the
I
beauty
think
of
it's,
it.
I think there's, I think in life, it's you gotta
No, I know,
find
you're
out.
right.
Okay, well, you're in luck. So this week was the first day of fall.
Yes, Monday.
When does duck hunting start?
So they have a
Teal
little-
was last week.
Teal is a little snippet right now, actually. But I have to go to a big event on Saturday, so I can't go teal hunting this weekend.
Way to ruin his life, Taylor.
Teal is before
Teal's
duck.
like a little, teal migrate early. So there's a little teaser, which is actually very, very short this year because teal numbers are down. They base it on that. Duck hunting starts in November and runs through the end of January, colder months. Deer hunting, I'm not a big deer hunter, but deer hunting starts, I think, this in October.
It's October 1st, bow season.
Yep.
Bow season opens up October 1st, and then
gun starts in November.
Yeah,
gun
starts
around
later.
duck, and then it runs basically almost into February.
I don't know why I know that.
My dad went to Texas last week on a dove hunt
Oh yeah,
Mhm.
That'd be awesome.
and killed
Kill them.
a
Would love
gazillion
to.
doves.
Dove hunting is a gentleman's sport.
Yeah.
It's a very much a, you have your little seat, you can wear your little vest, you can have your little drink, kind of sit
Yeah.
there.
That's what he said. He was like, it was a social hour.
Yeah, it's social. It's very social.
And
It's a rich man's sport.
I grew up deer. And it's like you're
fencing?
silent
Yeah.
in a
Yeah.
stand. Like
Yeah.
duck is a party.
Duck is a party.
Yeah.
Dove hunting.
That's a
Dove hunting is like a happy hour. Duck hunting is like it's not quite as social, but you have like 3 or 4 guys, which is I love because you're always hanging out and talking. Deer is a very solitary.
Yeah.
But that's because y'all are shoved in a blind together.
That's great. And all stuck in a line.
so fun. I
did it.
It's a great opportunity. Like some of my best days is like hunting with my dad because you got to sit for like
cool.
5 hours at 5 a.m.
Yep.
Usually freezing cold. You have mud everywhere. And then, you got to stay awake because you got to find them coming in. They scare you, and then you got to talk. So
that's pretty awesome.
A lot of talking.
I feel like it's always like Josh would go to Arkansas, and he would go up to Stuttgart, and they would go there to duck hunt. And I was like, I feel like y'all are just going back, reliving your college years, just in a duck blind.
Yeah.
I was like,
it's kind of what you do. Oh, I still duck hunt with the guys that I grew up with. When we go and we talk, I mean, we still have the same conversations and stories we have.
Same stories.
I'm sure that's what Josh is doing. Have the same stories.
Same stories.
20 years ago, it's talking about the same thing.
Stories.
And
so
but that's
cool.
it's really I think those types of like activities are it's all about the talking, the socializing, and I say that because like you get up and I'm not an early riser. Get up at 4 a.m. Like I'm like, how do you stay awake? Well, you stay awake by talking.
Yeah.
And I was interviewing a pilot one time. This is totally off subject. And I was like, how do pilots stay awake? You don't necessarily have to stay awake. But he's like, you know what the secret is?
I would prefer my pilot stay awake.
I know,
They don't necessarily have to.
But they do sleep. They have like sleeping quarters.
Who are they talking to?
Each other.
Okay.
He said that we like they teach you to talk, to actively engage in conversation, to stay awake.
What if your co-pilot's boring?
There's a whole, you got to watch this show. I'm not even going on this thing. There's a show on HBO by Nathan Fielder. It's this weird, bizarre show where he's a comedian, but he's concerned about its communication in the cockpit. He actually ends up becoming a pilot, like a real pilot in the end. It's really, anyway, but the whole thing about communication, but
you're saying,
okay, not flying. All
right, so you're set. Okay. Yeah, I'm like
duck hunting is about talking.
So
let's leave it there.
Duck hunting is about talking.
Okay,
not your pilot sleeping or anything.
Okay, so now tell me about eyes. Duck hunting to eyes.
Eyes. It's a good transition. Eyes are actually about talking also.
All right. So how do we keep these eyes open?
Yes.
And so today we are talking about it's bright-eyed and refreshed, the truth about eyelid surgery.
I feel like this is the best, easiest, biggest bang for your buck procedure that we do.
You just stole my line.
I'm serious. It is literally.
The results are amazing.
Oh my gosh. The downtime, the safety, the efficacy. It is life-changing in 2 hours.
I absolutely love like we were saying. Before
what
we
is
got
a
here,
blepharoplasty?
What is it?
Sorry.
So
very good surgery.
So blepharoplasty is essentially eyelid surgery. So you can have an upper blepharoplasty, which is where you address the upper eyelid, right? Or a lower blepharoplasty, where you address the lower eyelid. Now, the upper eyelid is typically mostly it's like excess skin that can hood over your eyelid, and it can actually, in some people, even obstruct their vision a little bit. You can also get these little fat pads, right, that can kind of fall and or stick out and make you look very tired, right, very hooded. It doesn't really affect the eyebrow position. That's more of a brow surgery, but it does help substantially open up your eyes. And it also, I think, by association, helps the brow position tremendously, because oftentimes people will be raising their eyebrows up, compensating for that excess skin. So upper eyelid surgery, I totally agree with Taylor, is the quickest, easiest, best bang for your buck by far. Now, lower eyelid surgery is, I think, the most, that's where you have either excess skin, you've got bags that protrude, right? And you can have, some other issues going on.
Elasticity changes just of the lower lids.
Of the lower lids. Now, lower eyelid surgery is very transformative, number one. Is something that you can do that doesn't take a tremendous amount of time, but does have some recovery associated with it. Because I say lower eyelids are the most delicate structure of the body.
That skin is so thin.
And the lower eyelid is a very sensitive area. It's an area that is defying gravity because it's suspended, right? It's not like the lower eyelid is falling.
It's just falling. Yeah.
Your lower eyelid is actually getting pulled up by your ligaments. So it's a very, very tenuous
delicate
area.
was a great description.
And to see the full results, it can take some time. But you combine those together and wow, it can have a huge effect.
So talk just a little bit quickly about eye anatomy. A lot of people are like, oh, I'm scared it's my eye.
Right.
Well, we're not even touching the eyeball.
Yeah. We're not touching the eyeball. So the eyeball is the realm of the ophthalmologist, right? So Dr. Weiler is not touching your eyeball.
Right.
No.
Nowhere near it.
Eyeballs freak me out anyway.
Yeah. Freak me out too. So we're very, very close to it. Upper eyelid surgery is probably, you're further away from it. Upper eyelid anatomy is pretty simple. So you've got skin, right? Obviously. Okay. And then you have, the fat can be kind of above or below the muscle, but it's mostly above the muscle. You have fat pads. And then you have these two little muscles that can raise the eyelid up and down. And so most patients, both male and female, this is probably 50-50, genetically and age and the way you live, you can develop a lot of excess kind of skin. And that skin can kind of hang down. It can hang down laterally. It can hang down in the middle. And some people, it's really not based on weight, but some people get enlargement of the fat pads or the weakness of the fat pads up here. So what upper eyelid surgery is you go in and you use, everybody has a natural crease. So you make an incision in that little natural crease. So it does hide very well. You remove all that excess skin. You also go in and remove, there's usually like two larger fat pads, one real close to your nose and one right around here. You can remove all that excess fat if needed. You don't want to leave some fat behind. You don't want to skeletonize, but you can remove the excess fat behind. And then some people actually have a little bit of dysfunction of the eyelid. In other words, like, so have you ever seen how like some people have like the lazy, droopy, not a lazy eye, but like a droopy eyelid, where it kind of falls down and makes you look tired. So that can be, you can be born that way. You can have an accident that causes that, or sometimes old age causes that. And what that is, it's one of those muscles pulling off of the cartilage plate of the eyelid. So you have two muscles that attach and they wrap around your eyeball. They go way back into your head and they're like window shades and they pull that eyelid up. Right. And so what can happen is if you get hit in the eye.
Between the and the
So the muscle pulls that eyelid up. And so accident wise, old age, sometimes that muscle pops off that cartilage plate. And so, and then that one muscle that's left can't hold that eyelid up. And so it tends to get lazy and falls. And so, and sometimes we actually go and we find that muscle, we pull it back down like a window shade and we tack it down. Yeah.
That's, I mean.
Yeah. And you can do it under a local, which means.
I was going to say, what type of anesthesia is involved with a blef?
So almost always on upper blefs, you could do that under local, which means a little bit of sedation. It can be an IV, it can be a little pill. We numb you up and we do it. And it works really well.
All right.
Quick recovery. I tell ladies, you'll be able, and men, do a lot of men, a little bruised and swollen. It's really important you take it easy for a day or two. But most patients look fairly presentable between 1 and 2 weeks.
Okay.
And they're good to go.
Because you got the black eyes.
Yeah. If you really, hopefully you take it easy, you don't get the black eyes.
Oh, okay. All right.
But most men don't pay attention and they don't follow directions. So they do get the black eyes, unfortunately. They go home and do something stupid. But yeah, it's a pretty quick recovery and it's an incredible results. And it really is quick, easy, and bang for the buck.
I love that.
Yep.
I feel like I was saying earlier before we came on, I do feel that I see this a lot, like on social media and stuff. Blefs, just like transformative.
Yeah, they really are.
It is because, well, and you were mentioning the windows. And so when you speak with somebody, you speak with their eyes, right? You talk to their face, you look at their eyes. And, the eyes, just like you're rolling in, you had a late night last night, right? Your eyes were droopy at first.
Yeah. Come on.
Right.
One time.
But
call you out.
But
I know.
The eyes are the window to the soul. You speak to somebody, you look at their eyes. And so it really infers a lot of information. So, it's something that is always out there. You don't wear clothes over your eyes. You don't walk around with an eye mask. Some people purposely wear glasses to hide their eyes. But it really is, it's a lot of bang for your buck.
Okay. Do y'all remember America's Next Top Model? Tyra Banks.
Yeah.
The modeling show. One of the biggest things on the show throughout the whole thing with all of the models was their eyes, smiling with your eyes, looking stuff with your eyes, and everything was very like eye focused when it was like all of the model training stuff.
Yeah. Wow.
But I think
stunning eyes and having enough, because like a lot of times as you age, that excess skin hides your eyes, and it's hiding those beautiful crystal blue eyes that some people have.
Lower lid.
Ooh, tougher.
Lower lid anatomy, lower lid. What are the main reasons that you age so rapidly? I feel like you age the quickest on your lower lids and neck.
Is that because they're fighting gravity?
Yes, and also I think genetics plays a huge role. So almost everybody gets a little bit of excess upper eyelid skin as you age, but lower lids to me is really due a lot to genetics. And you can't pick your parents, right? You're giving your parents, and so lower eyelids to me, most people come in and they have big bags below their eyes, which makes them look tired, makes them look heavier than they are, makes them look uninterested and bored, right? And so, or you have a lot of lax skin, right? And so lower eyelids are a little bit more complex. I tell all my patients, and so I'll give you my quick little talk. So whether you're 80 pounds or 800 pounds, the fat around your eyeball does not change. Okay.
Okay.
All right. What does change is what's holding that fat back. All right. Think of it like a sail on a sailboat. The sail starts at the eyelash line and it inserts, and I've got pretty good eyes, so but it basically inserts along this bone right here. Okay. And so when you're young,
you used to call that saran wrap? You now say sail on a sailboat? You used to say sail like saran wrap.
Saran wrap, did I? I've changed a little.
Sail like a sailboat.
Okay, a sailboat.
I like it. I like it.
All right. So when you're young, your sail's all nice and tight. All right. And that fat's being held back. Genetically, your sail, not you, Taylor, but if somebody comes in, your sail, because of your parents, has been programmed to fail. And your fat is now pushing out on that sail, and it's bulging out. And so that's what you're seeing is protrusion of bulging of that fat.
That's what I have.
So what we do is we go on the inside of your eyelid. We go in, there's 3 pockets, boom, boom, boom. We remove some, but not all the fat. You don't ever want to skeletonize, right? Some people have way too much. Some people have enough, but the sail's weak.
Yeah.
Then we want to open the sail, and we want to release the sail internally from the bottom. Then we're going to take that fat, the remaining fat, and we're going to drape it across where that sail attached.
Little drops of microfat right into that little...
to smooth that little area. Then, on some people that have the excess skin, I'm going to make a tiny little incision right below your eyelashes, and we're going to pinch out that little bit of excess skin. Then, if your skin's not too dark, I'm going to take a little laser, and we're going to zap that skin right here too to help tighten it. Not only pull it, but tighten it. And then the last little trick I tell patients, especially if you're older, is the reason your eyelids are looking worse and bulging out more is because most patients, as they age, are losing volume in the midface. And so your face is also sinking in. So the little cherry on top of your sundae is I would like to go in and put a little bit of fat through here. Or I'm going to send you over to Taylor after your procedure, and you're going to get a little volume through here to really give you that nice smooth appearance.
A little mid-face.
All right. Now,
pick it up.
It's a procedure that can be done under local, which means a little bit of a pill or a little bit of an IV, or we can do it under traditional anesthesia because some people freak out. It is very close to the eyeball.
That's what I feel. I feel like anything like close to that eye, it's more so. I don't even think that you're scared about the procedure. It's just being close to the eye. It's it's like
but if you take those little loopy pills, you're not.
Yep.
I mean, unless you're like cuckoo, like you might get a little cuckoo on the medicine.
It's really a personal decision.
Yeah,
it's really a personal decision.
No, I would have to full anesthesia. Full anesthesia.
Yeah,
oh my gosh.
Well, I think
absolutely.
The biggest thing for a lot of people is that the beauty of being able to take an oral medication without full anesthesia is just safer, quicker, easier. Right?
Some people very.
I hear you and I get it. Yeah. I totally understand it. I try to talk people out of like, no, you don't want to do anesthesia if you don't have to. Me, I was like, you're going to need to put me down. Like anything. There is a reason. I have always wanted to have LASIK.
I'm putting Britt down.
Can't do it. I'm going to need you to put me down. I can't do it.
Look at this energy over here. I'm putting her down.
Yeah. Oh, yeah.
She's going down.
She's going down. I did LASIKs.
You did?
Yeah. Let me tell you, I have a giant head, tiny little eyes, and I have a huge Cro-Magnon forehead. They could not get the device into my orbit.
Oh my goodness.
Because I came out like a prize fighter. I mean, black and blue.
Oh my gosh.
The surgeon that did is great, Dr. Williamson.
Wait, one at a time?
No, I did both at the same time.
Oh my gosh, I didn't know that.
Oh yeah, and you take a little pill, and he was like, "I can't get this in, man. I'm sorry." He got it in.
Oh God!
And then then it's over with before you know. But yeah, I came out of there. It's like
because you're awake, right? Like
you are awake.
You're awake. Yep. I feel like that's very intense.
Yeah, it's intense. It's like, but it worked. It was fine. Honestly, the intense part was getting it's basically it's a laser knife that comes on, but you have to get the device through the orbit on the eyeball.
Yeah.
And my little beady little eyes, my Cro-Magnon protective, you can't punch me in the eyes because I'm protected there.
But I'm like, I feel like the skin around your eyes is like good.
It is good.
Tight. Like you've got like the good.
We've got good genetics.
Yeah.
I don't really have a breath issue. But the problem with the lower eyelids is the recovery is a little bit longer.
Yeah.
It is. It's because of the swelling, the tissues are so sensitive. Mm-hmm. The bruising is usually more. So it's a little bit more of an investment.
Do you do a lot of upper and lower at the same time, or more upper, more lower? Like, is there
I would say I do a lot of them together. Mm-hmm. And we're going to speak with a young patient that we did do them together because traditionally, when you think of aesthetics or you think of plastic surgery or how you visualize somebody, like I'm looking at you right now and I'm looking at your eyes. Mm-hmm. I'm not looking at just the uppers. I'm not looking at just the lowers. I'm looking at them together. Mm-hmm.
And so, I think it complements each.
Yeah.
It complements.
Yeah.
And so when you think of the face, think of it as units. So I tell patients, if you're going to do your eyes and you need the uppers and lowers, do them together. Mm-hmm. Because if you do the lowers and you need your uppers are going to look a whole lot worse. And if you do your uppers and you need your lowers, oh my goodness, you're going to look really bad.
Yeah.
So now it doesn't mean that all patients get uppers and lowers, but I'd say a lot of my patients do get uppers and lowers together. I certainly do isolated lowers, mostly genetics, like patients that are really young, like 20s and 30s that have horrible genes, blame their parents. And then I do just uppers that is mostly aging, right? And then there's that middle section that is both aging and genetics combined together. So I do a lot of combos.
Do y'all do before somebody does the blephs? Do y'all Weiler like laser skin tightening or anything like that?
We do it during. So I just
same time.
No, I know that. I just didn't know if like there was any like
before,
when
after?
does it become a surgical issue and not.
Good question.
So that's a good question. I would say that whenever they're failing conservative therapy, and sometimes some people are not even a candidate for conservative therapy, meaning they have too big of a fat pad protrusion here that anything is going to kind of make it worse. Maybe they have too much excess eyelid skin that we cannot lift or, augment with Botox or filler.
Yeah.
So I think it comes sometimes genetically, they're a better candidate for a bleph, and we tell them right away. Maybe we have done Botox and some filler to camouflage, that little tear trough deformity through here, but they're ready to take it to the next step, or they're tired of doing filler every 2 years or so. So I think there's things that you can do in the interim. There's a newer drop on the market called Upneek. That stimulates that upper eyelid muscle that he was talking about. And it is just a little easy little drop that helps augment that
opens
lift.
The eye a little bit more. There's drops to whiten.
Lumify, yeah.
Lumify. Yeah. That's a whole, we'll talk. We're going to do a whole podcast on non-surgical improvements of the eyelids.
Yeah.
So
CO2, you can do CO2.
CO2,
alone around the eye. And that's more for textural and tightening. Mm-hmm. There comes a point where it's like you're ready for a surgical just need a result.
Yeah.
And it's not that much more of an investment and that much more downtime.
Yeah.
So that's kind of where they want the big permanent solution.
Yeah. Go ahead and get it.
Okay. Yep.
Well, y'all ready?
Yes.
Y'all ready? Okay. All right, everybody hang tight. We're going to go to commercial real quick, and we are going to bring our patient so we can talk about her experience with her bleph, which I'm so excited about.
Yes.
So
let's go, Heidi.
All right, hang tight. We'll be right back.
I'm Ashley Shelley. I'm from Baton Rouge, and I've had Sculptra, Botox, and aesthetic procedures at Weiler. I realized that it was time to start taking care of my skin. There were certain concerns that I had, loss of volume in my face and the texture. I knew that I needed to do something about it. Sculptra has boosted my self-esteem and increased my confidence in my skin. I'm 40 years old, and my skin has never looked better than it does now.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
All right, everyone, welcome back. We have our patient here with us, Heidi. Thank you so much for joining us today. And you're going to kind of tell us about your experience because you had an upper and a lower.
Upper and a lower.
Upper and lower.
Mm-hmm. Tell us a little bit
Upper
about
and lower
yourself.
breath, right?
Yeah.
Upper and lower what?
Upper and lower haircut.
I feel like we should be sponsored by Starbucks because here she is.
Always.
Starbucks, where you at?
It is glued to my hands from 8 a.m. until I almost want to stop on my way home for my second life that takes place after we leave work. No, so tell us a little bit about yourself. Are you from here? Where are you from? What you do?
Well, I'm originally from Montana.
Gorgeous.
But I've been here longer than there. I have 2 daughters. However, I am an empty nester now.
Goodness.
My youngest just graduated, and she's going to LSU.
Are you unwell?
It's getting better.
Okay.
I think the anxiety before her leaving was the hardest part. But now that she's
there and settled, and it's okay.
Yeah. She spends half of her time at home.
Does she?
She is not adjusting to dorm life very well.
Is she at Miller Mansion? Oh my gosh. Bringing back the memories.
Which is still in the works, which is crazy. Yeah. They said they were shutting it down in the 80s.
I know.
I'm always saying, I'm like telling the girls, I'm like, yeah, LSU's good. I'm like, you should go there just so they'll never leave me. Just so they'll never leave me.
I can't believe you're an empty nester. My word.
I know.
I can't believe, wait, so you're from Montana?
Mm-hmm.
I love that. I visited Montana this summer.
You did?
This summer. It was so fun.
I did too. I go every summer.
The weather up there is just way better.
Were you laughing at him when he was just talking about beautiful
swaths?
It's an acquired taste.
She's like, you're right, Montana.
The pictures
love it.
The pictures of the bayou are beautiful, but I don't want to be in it.
It seems a bit dangerous. Mm-hmm. No.
So let's get to your eyes.
Yeah, I want to talk about this because this is so neat.
Take us through the evolution. I mean, you are obviously absolutely stunning. Take us back to 18. What did your eyes bother you then? Kind of throughout your life, what have you done for prevention, correction, and then you're like, bam, I'm ready for the surgery. So give us a little history.
To be honest, I probably haven't been as careful with my skin as I should have been probably until maybe the last 20 years. You know, you start seeing the wrinkles and stuff and you're like, wait a minute.
Yeah. What's going on here?
So, yeah. Genetically, I knew that eventually I was going to have to get some kind of upper bleph because both my father and my mother have had upper blephs.
Oh, there you go.
There you go.
There you go.
Mm-hmm.
Genetics.
Now, my mom, she had, when she had hers, she is adamant that she can see. She's had glasses since she was 4, but she claims that since she got the bleph that she doesn't need her glasses. But I think that may be related to her cataract surgery.
Probably her cataract surgery. That's all right.
Sweet darling.
Nothing to do with the cataract surgery.
Right. Now, my dad, the thing that I clearly remember when he got his, since he lived so far away, I didn't see him until he was fully healed, was how open his eyes were and how blue they were.
I love that.
I didn't realize how blue they were until
that's amazing.
After he had that surgery, so that was pretty cool.
So you got your dad's eyes.
I mean, with a little green.
Yeah, your eyes
are really
are
blue.
Stunning.
Especially with that shirt.
My gosh.
I love that.
That's why I wore green today.
So you kind of knew in the back of your mind, this was heading for you.
Yeah. And then as far as the lower bleph, I didn't know if I needed to get it. Well, I don't think it really, there's no need for it, but I didn't realize how big the bags were until after the procedure.
Yeah. You knew you were going in to do the upper.
Right.
You went in for the upper because the eyelid skin was bothering you. Were you having any visual, not changes, but like, was it obstructing your vision at the end of the day, or was it strictly cosmetic? Just the excess skin was bothering you?
Not that I realized, but I do know that the skin was so saggy that I could like pinch it and it would just like stay.
Did you do anything like I was talking about earlier? Did you do any pre-treatments or anything like that?
Like, had you tried filler?
Yeah, like filler or anything?
Lasers?
No.
I love that.
I went straight for the bluff.
I love it. I love that. Which, I mean, because your eyes look absolutely amazing. I mean, like you were saying, like there no scar. Like this is how you're saying you hide it in the fold and everything. There's nothing you would never know.
Yep.
You just have like beautiful open eyes.
Yeah.
So came in for a consultation, talked to Dr. Weiler. He suggested
the lower.
Right? Right.
We talked about that a little bit, right?
Right.
Suggested the lower, and then
what were your thoughts?
Yeah,
you're like,
I brought that up.
Need that.
You're like, this guy's trying to.
I'm not scared of Dr. Weiler. I've had other procedures with Dr. Weiler.
This guy's telling me stuff. Me and Heidi go back.
I will say this. It goes back to trust.
Yeah.
She was not offended because she trusts you.
Yeah, and it's something I think I will bring up on occasion. It's one of the few things that I ever bring up. If somebody comes in and they're asking me about upper eyes or asking me about lower eyes isolated, and they need an upper or lower, I will suggest it to patients. I don't ever, have somebody come in and we're talking about thighs and say, oh, you need a tummy tuck, right? I don't know if somebody can come in, breast dog, or, hey, you need a facelift, so I don't ever get there. I don't think that's proper, but it is one of the few areas where I'll say,
look, it complements each other.
Because it complements. And I know patients will be upset or be back and say, why didn't you say something?
Yeah. That's
if it
good.
Looks uneven.
That's a good point.
Yeah.
That's like doing a breast dog only whenever they need a lift and a breast dog.
Right.
Yeah.
Right.
Okay. Yeah.
Okay. Wait, where were we at with that?
Then procedure. Had the procedure. Talk us about anesthesia, because this wuss over here.
Absolutely.
How are you sedated?
I was laughing at you too. It's so easy.
Is it you did the local?
I did the local. I took the little relaxing pill.
Were your eyes open? You saw what he was doing?
No, she doesn't remember.
I don't know.
You remember much about it?
I remember parts.
Bits and pieces, right?
Bits and pieces. Yeah. I remember the anesthetic going in a couple times, but
a couple little shots, right?
Yeah, the numbing medicine, right? Medicine. Okay, yeah.
Yeah, so I do tell patients, so, look, I'm with you, Britt. Like, if you're, I'm not, I'll be like a broken Bronco. I'm not doing you. But if patients and Heidi's calm, I mean, you're obviously, you're not afraid. You've done these things. The level of the pills, which is like a Valium we give, is typically amnestic, which means you'll remember bits and pieces here and there, but you won't have a vivid memory. You will feel some of the shots here and there, a little bit of numbing, right? But you won't really feel the surgery, right?
No. I need to be flooded with propofol.
I didn't feel anything.
We will, don't worry.
Just like so. Okay. So had the surgery. After the surgery, how what did it feel like? I need to know all the details. So when I go have it done, I have something.
So the first 2 days were a little uncomfortable. I think the hardest thing for me was to sleep elevated because I'm a side sleeper.
I sleep on my belly.
Oh, you can't sleep on your belly.
No, not on your face.
On your face. You look like Frankenstein.
Yeah.
So you did. It was having to elevate some.
Yeah. I think a lot of people, the biggest issue is sleeping on your back. If you're not a back sleeper, sleeping a little bit elevated, right?
And that's for swelling.
Yeah, for swelling purposes. And then, not being able to see very well for the first day or two, right? Having to wear
your eyes
ice packs, you're icing things down. So I do tell patients, 48 hours is the most important. So what I say is elevate, sleep on your back, ice as much as you can, and try to keep your eyes as closed as much as you can.
Closed.
It just lessens the swelling of the eyelids and the eyeball, which is because we're not operating on the eyeball, but we're around the eyeball, so we don't want to get swelling of the eyeball. So if you keep your eyes closed, it lessens the swelling of the eyeball. And so that's really the most important, is the first 48 hours.
Yeah.
So that's it. So the sleeping, you're saying that, was it painful?
No. I mean, I had the painkillers. I probably could have done without them. I took them the first day, maybe the second morning, and then after that, the pain was
fine.
Gone.
You were good to go.
I looked like a monster for about
That's
a
okay.
week, but
that's how it looked.
Yeah, and you use the right word. I use that word too, monster, right? And I tell patients, you're going to look like a monster for about 5 to 7 days. It's going to look like I popped you in the eyes, especially the lower eyelids.
Okay, I was going to say.
It's the lower eyelids.
And because of the CO2, the resurfacing.
Yeah, well, the lower, like I said, lower eyelids is a much more recovery-oriented procedure. It's because of the delicacy of the tissues. The upper eyelids alone could be a week.
Yeah.
And you're looking pretty good. Lower eyelids, I tell patients, somewhere between 2 and 3 weeks.
Yeah.
in terms of looking good. And it is because the skin here is so thin, it just swells up like crazy.
Are there any stitches?
There are no stitches on the inside of the eyelid, so we're not moving anything, but we do have stitches right below and right above too, a little bit too sometimes.
Dissolve it like
they dissolve.
Yeah.
They're like the size of a human hair. Sometimes we'll cut the knot a little bit, but for the most part, they kind of dissolve.
They just kind of, okay.
Yeah.
How do you feel? Like after you, you said you just had it done in
July.
So
3 months roughly.
right around almost 3 months. How do you feel like with your with like the results and everything? Do you think it's a big deal? Which I don't know the before and afters, but
we haven't given Britt privy to your pictures.
Can we put a before and after picture of her on here? That would be awesome.
It'll be up to Heidi. We don't necessarily have to, but it's up to her.
Yeah, up to Heidi.
I don't mind. You'll be surprised.
I would say this. I've known Heidi. I appreciate the color of her eyes.
Yes.
Now more than
so much more than
ever. Do you agree with that?
Yes.
Her eye color is so prominent and beautiful since the surgery, and it always has been. The eye color has not changed. It's just that you see it so much more.
I know that I get compliments on my eyes a lot now.
A lot.
Yeah, beautiful eyes.
Yeah.
We were talking about the color wheel earlier in a different episode, right? And you look
She's real green. I know. I'm like, this is it.
Very beautiful today, and it matches. You have very beautiful eyes. And I do tell patients, especially men and women, when you open because the aperture of the eye is relatively small in comparison to the rest of your body, right?
Mm-hmm.
And eye color is vivid on a lot of people. It's not something that dulls as you get older.
Yeah.
I mean, cataracts can affect it a little bit, but it really you lose that sort of flash as you get older because of the excess skin and issues around it. So it really is remarkable when you sort of tighten and remove and clean it all up. But wow, those eyes popping in.
It's like you're cleaning like a dirty windshield. You know what I mean?
Yeah.
It's like everything's just like bright and you can see with it.
I love it.
I was going to say, did you have any, corrective vision results like your mom? No.
Yeah. No, I will tell you. And I told Dr. Weiler, maybe it's like the placebo effect or whatever. I wear contacts and before the surgery, almost every day I was taking them out and throwing them out the window on my way home.
Because of dry eye?
Yes, dry. And after the surgery, I feel like some days I go till 5, 6, 7 o'clock with my contacts in now.
Wow.
I don't know if that's just in my head or if it really was
the
eyelid.
I mean, it was irritating.
Probably.
Wow.
I do not have a medical answer for that.
Yeah,
one, but
I think it was irritating.
I'll take the compliment.
Sounded like
your mom does.
I know
have
I'm
better
sounding like my mom over here.
Your mama is not crazy.
I was about to say these results are fantastic.
New surgery for vision correction.
Yeah,
I'm gonna have about bad comments from the ophthalmologist.
That's what I was like. You got a 3 for 1, upper, lower, and corrective vision. I mean, that's amazing. Well, I love it. So we always ask patients if someone were on the fence about having a blepharoplasty, what would you tell them?
I would tell them to do it. It's worth it. Like Taylor said, it's the biggest bang for your buck. I don't have any complaints about it.
Do you have more confidence now, like post surgery?
I feel like I do.
Yeah. Like your eyes are so pretty. I mean, they're so pretty.
she's beautiful.
I know.
Her skin, your skin texture, everything is.
How long did it take you after the procedure to feel good, feel comfortable? Does that make sense? Like, oh yeah, because I know, like you used the word monster, right? The first week or two, it's especially lower lids can be a little rough. When did you start saying, oh, okay? Like, was it 3 weeks? Was it 6 weeks? Was it sort of just last few weeks? Kind of coming in. What are your thoughts on that?
Well, I think one of my biggest concerns going in was I knew that in 3 weeks I had to go back to work. So during the first week I was like, oh no, what did I do?
Oh gosh.
Coworkers think I'm nuts.
And then I went to my 1 week appointment and she was like, you can't wear makeup quite yet. And I was like, oh. By the time I went back to work, I was able to put makeup on and cover the scars a little bit. The swelling was still a little, because I did the cheeks too.
Yep, you did your cheeks too.
So I had a little bit of swelling still. People couldn't really pinpoint what was
what you
different.
did. Yeah.
But something was a little shinier.
I've gotten a lot of, oh, you look so refreshed.
You do.
Yeah.
Yeah.
She does.
She slept last night.
I mean, yeah, right.
Yeah, right. I did not. It looks like you have received so much good sleep over the past 10 years.
Does it?
It does.
I haven't.
It does.
Aging backwards, girl. Aging backwards.
I know. Absolutely. I love that.
Empty nester.
I
ready to
know.
roll.
I want to. I want to do it.
Did your kids notice? Speaking of,
Um,
did they say
they
anything?
did. Yeah, they're kind of indifferent.
Yeah.
Like any
They're like,
kid,
all right,
yeah,
Mom,
My oldest, like, Mom, why are you doing that?
yeah, exactly.
Did you tell
Because
them?
mom
like,
ain't dead yet, hon. Mom has a life too.
Right.
But you should tell them, be like, I'm sorry, it's genetics. It's coming.
You're headed for
Buckle
it.
up. Yeah, like I just want to let you know your grandmother and your grandfather had one too. So just get comfortable with
Right.
having
It's a Halloween present. Happy Halloween.
I'm like, it's coming. All right. Well, I think we kind of touched on everything
Yes.
Yeah.
regarding this.
Thank you, Heidi, so much. You are
Heidi,
beautiful.
Yes, thank you
thanks
so
for
much
having
for
me.
coming.
Anything you would say to the audience out there that's considering a bleph? Does that make sense?
Him. I mean, her.
Not you.
Not
Not
you.
Not you. She said it earlier. Do it.
No.
Go
I would
into
say,
the
I would say
Monster.
go
I
for
know,
it.
but like to sum it up, like, what do you think holds people back a little bit? Does that make sense? Like, what would
Fear, like
fear.
Right.
Yes.
Fear of the anesthesia, fear of the recovery.
The eyes.
The
You're touching the
eye.
eyes.
but he doesn't
You're
touch,
not
like he
touching-
said.
I
he's
know
not
you're not
touching your
touching
eye.
the eyes.
Touching your eyes.
But
Let's
that's
clarify that.
But I bet, like, did you have that fear that, is he going to mess with my eye, around my eyes?
Well, no. Like I said,
Okay.
Well, apparently I did because I corrected a vision too.
like I said, Dr. Weiler's done other procedures for
Mm-hmm.
me, so I trusted what he was doing, and I wasn't worried. I was excited.
Like,
Like
trust there, which
yeah.
is good.
Look
Thank
at
you,
you.
Heidi.
Yeah, that's it.
Look at you,
Trust.
that trustworthy
now
physician
afterwards,
over
I
there.
was like, "What did I do?" Because my
Yeah.
face was like,
Yeah.
You were
This-
swollen.
Oh, yeah.
yeah.
But the results panned
A lot of
out
hand
after a
holding the
while.
first
Yeah.
couple of days. Definitely.
Yeah.
Yeah.
No.
Just calling him like, what happened? I trusted you.
Well, it was funny because the next day I had a lot of swelling, and I came in and I could barely see it.
Mhm.
I did a little steroid pack for that, and that helped a lot. But the lady was like, "Oh, well, how are you feeling? You look great."
You're doing great, Heidi. You're doing great. I promise.
Those nurses are always positive.
Yeah, she was like, "It's gonna get better."
It's gonna be great. Just hang in there, girl. Just hang in there. All right. Well, thank you so much, Heidi. I appreciate you coming on here and telling us about your procedure. And like I said, I mean, it looks absolutely amazing. You look so well rested.
Thank you.
And remember to like, subscribe, follow us on all of the
Below, right?
platforms, the
YouTube.
Instagram, TikTok, YouTube, Spotify, wherever you listen,
Apple.
wherever you listen for your podcast. And just always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.